The COVID-19 lockdown restrictions, retrenchments and working from home, amongst various other issues, that's all had an impact on the mental, emotional and physical well-being of many people, including employees. Now, this is according to the SA Institute of Chartered Accountants. A survey conducted by the Institute found that the majority of companies surveyed did not provide incentives for a healthy lifestyle. Physical exercise, a reduction in alcohol and tobacco use, and sleep management are rarely monitored. The report also shows that the health and well-being of an employee is crucial for a company's bottom line. But how do we steer companies in that direction? Well, for more on the story now, we're joined by the Institute's Director of Integrated Reporting, Loshni Naidoo. Loshni, good morning. Thanks very much for your time on the AM report. So this is quite interesting that the Institute for Chartered Accountants actually undertook this kind of survey in the first place. Just take us through what prompted the Institute to do this.
Thank you so much and good morning. So to take us back, we started the work in 2018. We realized that health and well-being of employees is fundamental to the performance of a company, and in a much larger perspective, it has wide-ranging impacts for society as well as for the country. Now, like rightly said, you're saying, we are a financial institution, we are looking after chartered accountants, so why are we specifically looking at health and well-being? So we understand that from presenteeism, absenteeism, these have fundamental impacts on a company's bottom line. So companies are losing money from a productivity perspective because employees coming into the office are not always present, or they are taking time off to deal with emotional, mental, or other health issues. But it is wider than that. The more important thing is that companies need to be doing the right thing. There's an impact on being a good corporate citizen. So we felt that as an institute, we need to ask accountants in the financial services sector and where our people work to start thinking broader and look at the environmental and social issues and challenges and how that impacts the company and how they can play a role towards being a good corporate citizen. So the work started in 2018. We brought together a whole host of specialists around HR, employee health and well-being, and people who are passionate about managing health and well-being of employees. And what we said was the starting point was we really needed to get an understanding of where corporate South Africa was from a perspective of managing employee health and well-being within their companies. So that is where the survey started. It was really to just get a status and understanding of what corporate South Africa is doing and where do we need to go from there.
So the survey completed by 172 companies. It's very interesting that, given the results of the survey, that more than 50% of those companies that took part are actually from the financial sector.
Yes, we did open it out quite widely to anybody and everybody within corporate South Africa to please respond. It was interesting that it was really the financial services sector that participated quite widely. We did see from the mining sector, as well as from the hospitality sector, it was a very slow, limited response. Yeah. But then I think maybe that's due to the fact that, especially from the mining sector, the petrochemical, oil and gas sectors, where we have heavy impacts in terms of occupational health and safety of employees, I think those kind of practices are quite embedded in those organizations and those companies because you have to put safety of employees first, really, in terms of the type of work that employees are expected to do. Yeah, but it is heartwarming, that we had that kind of response.
Yeah. If ever there was an incentive to focus more on the health and well-being of employees, it's because of the reasons you've just stated, that it actually has a very real impact on the bottom line of a company.
Yes, definitely. What we do find, like if you look at when we started the work and some of the research that we undertook in this space, it's actually quite scary in terms of the numbers. So, for example, one of the stats that we saw was that the non-communicable diseases result in about 51% of workforce-related deaths in South Africa. And this is a stat in 2016. And in 2019, when we were looking at this, South Africa was rated the most unhealthiest country out of, I think, 191 countries. And they were looking at 10 specific indicators, which included physical activity, obesity, unhealthy lifestyles related to diet, smoking, or alcohol use. So these have big impacts on your workforce, especially if your workforce cannot perform, cannot come into work. The healthcare costs, I mean, the numbers that we were seeing were staggering in terms of what companies would have to pay, including employees themselves, in terms of the healthcare costs and the burden of healthcare costs.
So 51% of the companies surveyed actually have an annual budget, or they have dedicated funds for health and well-being initiatives for their employees. But the majority of companies, according to the results from your survey, don't believe that it's necessary to get involved in those areas at the moment. How do we change that? How do we change that kind of mindset?
So that is the next phase of the work that we are looking at, because this is really important and we have to get companies on board. And I think the first step, which we've realized, is convincing companies that why you need to be looking at these practices and embedding some of these programs and policies, because it will shift how employees are managed. I mean, if you look at it, companies, you and I are probably used to seeing this, that companies say that the employees are the heart of our business. But if you're not managing health and well-being as one of those aspects, how do you say that? So the next step, and to build on the work that we started, is to try and demonstrate to companies for some of these practices why you should be looking at them. So almost kind of the business case. So what is in it for you? What is in it for your employee? Because if we think about it, if an employee feels that they're more than just a number, that are part of something bigger or part of a family, part of where they are valued, there is evidence to suggest that they would give more and promote, participate in that company more readily than, if I'm just considered I'm a number who, clocks a card and walks in and clocks a card and walks out. We've also seen now that companies who embrace environmental and social challenges like employee health and well-being and internalize it, so make it and embed it as part of their governance processes and their strategies and how they execute their business, they tend to outperform from a market share perspective than those companies who still treat these aspects as externalities. So, they thought of as something separate to a company.
Yeah, absolutely.
So the first step for us now as SAICA is we're looking at some of these practices and trying to develop business cases for companies, regardless of size, to say, okay, this is why you should be thinking about this. This is the impact that you would have. This is the impact on your business and on your employees. And hopefully that starts changing the conversation and way companies approach certain practices.
Yeah, absolutely. I mean, according to the survey, again, most successful and innovative organizations actually make employee health and well-being a real focus. Loshni, thanks very much for your time this morning on the AM Report. Loshni Naidoo is from the SA Institute of Chartered Accountants. Quite an interesting survey, that one.